Hello everyone. What you're going to see and hear in the video that follows is a session on AI for mental health people that are done at the Amrita Hospital, Department of Psychiatry and Department of Clinical Psychology. The participants of this session were the postgraduate students of the two departments, and the session was hosted by Dr. Bindu Menon, head of the Psychiatry department. This is a fairly interactive session in which the PG students and the HOD interacted to understand how AI can be applied for their diagnosis of patients and probably even to some extent evaluating the diseases that people come with via the use of AI tools. And the structure of the session, which lasted for about, I would say, 90 minutes, was a mix of some theory, basics of artificial intelligence, and followed by a simple application that I had created for mental health professionals. The first part of the session covered, in general, the AI's architecture, different AI tools, example ChatGPT, Gemini, etc. And in general also the use of AI tools for day-to-day use beyond medical. But then since the HOD had specifically requested that I tailor the session for mental health professionals, I had done some personal research and I had tried to tailor the session so that it becomes more relevant and useful for them. To do that, after the initial introduction, while I was creating the content, I had used ChatGPT to create a simple mental health diagnosis application. The entire application itself was done by AI framework, so I would say a set of about 4 to 5 prompts that allowed me to diagnose 5 different mental conditions, and it's a selector where you have 5 different mental conditions. The software would ask you 10 different questions to fill, all multiple choice questions, and then based on that it would do an analysis about what could be the potential challenge with the patient, and also attempt to prescribe from a drop down menu the applicable medicines that the patient can take. And now remember, this being mental health, nothing was auto-generated. So for example, the prescription was suggestive. The doctor would have to look at it and then validate it, vet it, sign it, and then release it to the patient. So that was the first application. The second one was a simple voice note that I had created, and I had simulated the example of exam fear, which literally everyone goes through. So my challenge here, or the problem that I was trying to understand and help a student self-analyze or maybe consult with the doctor would be record a voice clip about exam fever, a specific instance. In this case, the student wanted to write the MBA entrance exam, was preparing hard for it, at some point of time entered into a panic state and was unsure whether the person could write the exam or not. And this voice recording, I had uploaded it to ChatGPT and asked ChatGPT to prepare a complete, detailed case study of this particular person, which is typically what would be used by the clinical psychology professionals to evaluate. We talked about what AI can do, how coding can be automated, how case studies could potentially be analyzed by AI, and how it could aid them deal with patients in a better manner, where we use AI as a tool and as an assistant for professionals who are well trained in the mental health care department. Now, to conclude, none of what I had done in the session was intended for people to use AI as a tool to self-diagnose. So this was more from a doctor's perspective on how they could use it and speed up their diagnosis and analysis. Thank you.